I tried to get somebody in my group to do the readout. There were no takers, so if I miss something, I hope they stand up and fill in. And I think this is an interesting position to be. I was the moderator of the last panel. I'm the last on the readouts. You'll hear, I think, some themes from our discussion that were coming up in other discussions. I think you'll also hear us take positions in our discussion that are contrary to what others were saying. On day one, we were very much challenged to think big. Then in the instruction session this morning, we were also challenged to come back with 2 or 3 big ideas. And that is what our group did. Our group thought big. And so I think our first big idea that we want to put forth to the COP planning team is to really use COP28 to advance the funding and financing aspect of the climate health nexus. And we do draw the distinction, and we do say both funding, because that's often kind of on the grant side, and financing, anything from kind of capital preservation to fully commercial and other innovative mechanisms coming together. So we would challenge the organizing team to put together a $10 billion commitment platform for the climate health nexus. Now, it's a big number, and we had a lot of debate about what is the right number. Can we be precise in that way? I think our message is the number might be able to be manipulated this way or that way, but the idea is to have a rallying number, to have a number that people can coalesce around. And so what is that? Where is that funding? So we kind of had 3 buckets. Unlocking existing dollars. So I think one of the previous groups mentioned how there is climate financing money that is not always utilized. Somebody in our group called out some specific funds that are kind of underutilized. So there's unlocking those dollars. There's reframing. So there's existing money out there that is not necessarily directed at the climate health nexus that can be moved in that way. And then there is, driving new dollars. So we think to get to this rallying number, you really need to use these 3 kind of avenues. So where do you look? And our group came up with a number of different ideas. Existing adaptation funding, again, development dollars dedicated to climate health dollars that could be shifted into the nexus, health system strengthening, greening dollars, innovative mechanisms like pollution penalties, and then not wanting to kind of like reach onto the mitigation side, but targeted mitigation dollars for where there's an overlap or an alignment between adaptation and mitigation. Who do you go to? So we talked about traditional philanthropies, multinationals, companies, state aids, government budget, DFIs, sovereign wealth funds, high net worth individuals. I think the message here is that it is a collaborative need. It is a collaborative need to bring all of these different peoples and sources together. For collaboration, we also really talked about, at the country level, the need to get Ministry of Finance, Ministry of Health, Ministry of Environment together. We talked about international NGOs, reaching across the health and the climate space. We talked about presidencies, and we talked about the model that existed in HIV from about 15 years ago, where there were national AIDS councils and there's a lot of criticism about did that create a silo, but for a limited period of time, it created an intense focus at the presidential level on a specific area. In terms of leading up to COP, how do we get to this rallying level of commitment? We talked about, G7, UN General Assembly, World Health Assembly, but we also talked about, somebody mentioned summer. And this idea of summer is, extreme heat that happens in certain countries, and using that as a momentum building point, using that, with the media as a way to just get public opinion behind this, that it's not necessarily all, kind of the political meetings and bodies, but we want to move public opinion. So big idea number 2 in support of our first big idea is that really to mobilize capital, we need to create a stronger climate health story, and we should do this through an investment framework. And doing this type of investment framework should probably include 3 big areas. Climate relevance, and within climate relevance, we talked about nutrition, pollution, supply chain management, climate induced disasters, infectious diseases, heat. So again, lots of areas to dig down in and solidify there. We talked about vulnerable populations. We talked about any framework that exists need to have flexibility so that it can reach across the various vulnerable populations, right? So under fives, island states, LMICs, climate-driven migrants. And then we talked about health outcomes, making sure that there was a health outcome component. And I think, for us, this idea that one of the other groups touched on in terms of a defined terminology, so everybody understands the same terminology, and we have kind of a way to measure ourselves. Somebody in our group mentioned monitoring, and that, it's important to have some type of monitoring. Well, an investment framework gives you that monitoring toolkit. Big idea number 3, creating a pipeline of catalytic mechanisms. So, for us, kind of that investment framework will help you get to the what, but you also need a how, right? So we had a lot of discussion about, well, how do you motivate, financial funds or financial investors to be interested in some of this? Well, you do that through various creative mechanisms. So we talked about basket funding that blends different sources and types of capital. We talked about early stage funds that will drive technology, innovation, product development. We talked about using the high income markets to subsidize low or lower middle income market. So creating investment opportunities where you kind of introduce new products or technologies, and you can have that cross subsidization. We talked about really thinking outside of the box and creating new or innovative approaches, looking at economic investment cases, and maybe looking at cost reduction, and driving cost reduction, but then using those cost savings to plow back in as investments. We talked about top-up funds. So if we're already doing SMC in under fives, is there a way to kind of create a top-up fund so that 6-year-olds or up to whatever age can also get the benefit of that? And we talked about equity. We talked about the need for various types of equity, from the commercial side to the more patient side to the kind that looks at revenue sharing. Siobhan challenged, I think, the financing group to think about how do you unlock with multilaterals financing going to health. And so there we thought that, again, we need a stronger narrative. We need a stronger body of evidence. I think the folks in the group felt like there needed to be more cost benefit and more research done. We need a clearer articulation of return on investment plus social return on investment, and we need to link those together. This part, I think, was really impactful, is that you've got to create the in-country demand. So you've got to work with governments to want to increase their multilateral, lending. And we talked about how Global Fund has, a creative mechanism to help buy down the cost of that debt. So finding those types of creative mechanisms. We talked about in malaria how insecticide-treated nets created a tipping point. So here's a new product that really changed the malaria prevention landscape. And so we talked about identifying, developing those new products, so creating the investment to drive that so you can get to that tipping point. We talked about a sandbox for innovation that would help to reduce the cost of risk. So lots of times development costs are prohibitively high because of the risk premium associated with that. There was an example we talked about in India with a sandbox that is being created for digital solutions. We talked about co-financing, and we talked about driving co-financing between the private sector and multilaterals, and doing that through market development. So again, you have to develop the market for what will that co-financing serve. And our last question that we kind of prepared for the readout was around, from a financing perspective, what does success for the health system at large look like? And we had a lot of discussion here. I think we ended on that looks like a costed and resourced climate resilient health system plan, one that is country owned, one that is developed while also building capability and capacity of a strong government team to own. We talked about how that resource part of that would blend financial resources, so would blend government budgets and grants, performance-based financing, other concessional lending. And we talked about how that would also link public and private sector to drive financial sustainability. What we didn't talk about was a lot, but one of the things we wanted to mention was we didn't talk about access to financing. And so that, if we had another couple of hours, that would have been the next topic for us to go to. So we leave that with the COP planning team for yourselves. Thank you.